Kia ora. Ko Ngāhina Waretini tōku ingoa. My name's Ngāhina Waretini and I'm a Māori health promoter for the National Cervical Screening Program. It's my privilege to meet many women and encourage them to know about the importance of a cervical smear test. There have been many women in my life that have encouraged me and also supported me in knowing about that important message of atawhaitia te whare tangata. Taua me kura, Tyodor Briggs was one of those women. As well, there are many other women we're going to meet today that will talk about their story as they've promoted the cervical screening message, he wahine he taonga, every woman is a treasure. Kia ora. Okay. Kia ora kōrua, Wendy and Leanne, thank you for being here today. I've got some questions. You're both Māori nurses and you've both been champions of cervical screening and promoting cervical screening. Tell me a little bit about how your journey started as a Māori nurse and a smear taker. Wendy.
Oh gosh, my journey actually as a smear taker started many years ago. I guess there's a couple of decades in there now. I think my first time I trained as a Māori smear taker was in 1990, and it was working for a Māori provider away down south in Murihiku. But as my years have gone by, I came to Christchurch in 97, and I think for me I first came to me as a woman, and it was like, where are the Māori smear takers in Canterbury? And that was my first realisation that they were hard to come by. So cervical screening, and had just finished training some Māori smear takers, and I also put my hand up. So that was about 98 I joined a team with cervical screening program in Canterbury. What about you, Leanne?
I think I wanted to get into smear taking when we first opened Pikitiora Medical Centre, and being a practice nurse there, I thought if we have male doctors, our woman would like a choice of a female smear taker, you know, not just a male GP. So went off and did my training, and my mate here helped supervise that, and so that there was a woman available for our women patients, so that they gave them a choice.
I think it's really great to have choices.
Yes.
And being a Māori smear taker for both of us has been, I mean, this is 2013 and I'm still doing it. So it's really important. Through all the other career moves that I've made, I still keep coming back. It keeps me real, working with real women. So yeah.
Thank you. My next question would be regarding working with Māori, and I know that you work also with all range of other women, but specifically working for Māori, sometimes as women we're very busy, we have the importance of our whānau, and we may put our health checks down to being on another day. But for those women that you do know end up coming to one of your smear clinics, what are some of the things that you find Māori women can be feeling when they first arrive for the first time for a smear?
Whakamā to start with.
Yeah, very whakamā to start with. But I think if you have a relaxed and a bit of a sense of humour, and then of course we do a bit of whanaungatanga as well, so then that relaxes them a bit more, and then we talk, and then we'll get into what actually is involved. And and I think letting them know what actually is involved, why we do it, how we do it, why we take these samples, and look at the outcome of that, and then they're not so bad. And you know, after they've had it, they're going, oh, is that all it was? You know, I got myself all anxious and over nothing. So making that first experience positive keeps them coming back.
Absolutely.
You know?
Totally agree.
Yeah.
Taking the history is always the hard part. Taking the smear part is the easy part. But having that good experience, like Leanne has just said, helps for them to come back to whoever, any other clinic. At our clinics, it's like it becomes a team approach. our health promoters, our Māori health promoters out the front, who are greeting and meeting and having that cup of tea or a bit of kai, or having that kōrero with the nannies or whoever's out there, the whānau. Even the kids come along, you know, and they're all waiting in the waiting room. Hey, if they want to bring their pepe into the clinic room, kei te pai, that's fine. If they want to bring whānau members into the clinic room. But my one core role would be to give them that good experience. They will continue to come back to other clinics.
And sometimes they'll have maybe just a wee baby. Oh, I'm sorry, I have to bring my baby. I said, don't be sorry, bring your baby.
Yeah.
Oh, but they might tangi. And I said, that's all right, we'll sit baby on top of you. I can still do your smear.
Right.
You know, so, and, you know, they're keeping baby busy. Before they know it, the smear's over and done with. You know, so, yeah, that makes it another positive experience. Yeah.
So just with what you've shared, you've talked about from your experience about giving a woman a quality experience, being supported, being aware of her whānau that she will bring, as well as there may be that she requires to bring her children. And there's a health promotion team that will support that whānau. So if there were to other providers that are providing a smear taking service, if a woman was to arrive with their whānau, what would be the best advice you could give to other practitioners regarding the whānau that has come to support their
Look,
whānau?
I understand other clinics may be arranged a little bit different, and a lot of the times time is a big factor around going into a general practice clinic, but all practitioners try and make the best experience for all patients, no matter what clinic it is. We have the uniqueness of being Māori, working with Māori Wahine. I mean, that is unique in itself. There's not enough of us, not enough Māori nurses, let alone Māori smear takers. But other clinics, I think they have to do what they're doing. There's lots of good educations and programs out there now about engaging with Māori patients. Our GPs are trying to do it at the best that they possibly can for the times that they have. Coming along with a whānau, I wouldn't suggest taking 20 into a clinic room. It's not even appropriate, or the room in our clinics. But certainly if your tuahine or your kui or your mama wants to come into the room with you, then kei te pai. You know, that's fine. That's fine. And I'm sure a practice nurse or GP, no matter what clinic you go to, will try and accommodate the best that they can.
So tell me a little bit about the history of the free smear clinics. I know that for some of them they started at Rihua Marae, others started in other locations, but just give us a little bit of a story regarding that.
Oh, you started the first.
I think there's been a number of community-based clinics, and whether it's been at a marae or in the community hall down at the local environment or community, you know, for example, Phillipstown or Linwood, out at Rangiora, at the netball, you know, tournaments. The idea of Māori clinics is they've always been suitcase clinics, so they've been able to pick up mobile and go where they've gone. I can remember doing a clinic in a rugby shed where there was no power, but we had all battery operated lights and equipment. It was just a bit cold, but kei te pai, we did it, and it was in an environment or community based environment where it was easy accessible, and I think accessible has been the ultimate word. We go to wherever. I can remember doing a clinic at a house where they were running a should I say Tupperware party, or should I say, I think in the evening it was it was one of those underwear night parties.
Yes.
Where they were having this huge ladies' evening in one room, and as a woman would come into the bedroom, and I was running a clinic in the bedroom, and they work well, you know. You just do what you do and have a lot of fun with it. Yeah.
Smear parties, we call them.
Smear parties.
Smear
Parties,
parties.
yes. And it very successful.
Food and a bit of wine.
Yeah, absolutely. And like Wendy said, this one occasion we were selling, a lady was there selling clothes. So, and I was doing smears. When the ladies were ready, I'll have mine now. So I'd take them in the other room, we'd do the smear. They'd come out, we'd try on more clothes. And then after everyone had finished, then we all sat down, and it was amazing the amount of questions that came out after that. Like, so why is every 3 years? The education came after they had their smears. Yeah, because we'd finished trying on all the clothes, and that cost me $250 that night on clothes. So, very successful it was. But yeah, they work, and they were so relaxed. They said, we'll do this again.
I think the important thing about community smear clinics is not only do we try to make it accessible for women, but they're free. And Cervical Screening program have allowed us to actually support free clinics for all. In fact, we pay them. We give them a koha to come to us. Whether it be one of those beautiful T-shirts or in the early days it was just like a little cake of soap. We gave them a koha to actually come and see us. And because we know how hard it is for women to actually come and see us. We're working with a very precious area, te whare tangata, and we recognise that. For Māori women, we recognise that, how special that is. Yeah.
Kia ora. You've touched on different things regarding the history of the different clinics, the innovation, I guess I would say, and the dedication that you've both had in providing those free clinics. So let's talk more about the priority groups now. Why is it that Māori women can attend a free smear clinic? How does that work?
Well, at the moment, our national stats for Māori women aren't the best, and you find that they are the ones that aren't accessing, free screening or their GPs for smears. Hence why we're doing these free clinics, to try and increase those stats. But, young Māori women are dying unnecessarily of cervical cancer because they're not getting screened. So this is why they are a priority, the same as Pacific, same as Asian. And these free clinics are slowly, but they are increasing our stats, so that we should be up around 80%, but we're not. So it's slowly but surely increasing. And our whānau should know that screening, cervical screening is the only cancer we can prevent through screening. Losing my own mother to cervical cancer, the rest of my whānau now realised this. So be around for your mokos. Come and get screened. There are free clinics out there if they're not accessing their GPs, and sometimes they're not because of financial burden. That on top of a GP visit, is a barrier. So know that there are free clinics out there, and just call 0800 729 729, and Cervical Screening will give you the details of free clinics within your area.
I think, honestly, I think Leanne has said it all, and just echoing in some of the kōrero, this is a prevention. Having a smear is actually a prevention. It's we're not looking for cancer, we're looking for changed cells, and I think that is really important for women to hear. Particularly Māori women, some of them are too afraid to come and have a smear because of what we might find. Actually, we don't look for cancer. We look for cells that are changing, that allows us to work with the woman to enter into other programs if need be. Go into a colposcopy is having another closer look to see what it is. We can walk those women through those programs. We have support teams and support groups to actually allow that to happen. Working with high needs women and low socioeconomic women is a huge priority group for us. You know, yes, we're Māori smear takers, and yes, this message is for Māori women, and we want to see all Māori women come for a smear. If they're between 20 and 70, and if they are sexually active, sexually active and 20, then they come for a smear. If they are 16 and sexually active, no, they need to wait until they're 20. There is still time. Our stats in Canterbury aren't high. Like Leanne has pointed out, I think we're something about 67% of our Māori women having smears. That is way too low. And so, yes, we do need to increase that number up to 80%. So as a collective group, we're all going to start working together to actually get our Māori women to either their GPs or our community clinics, and like Leanne has already pointed out the number. Yeah.
Since the earthquake, so many families have moved, and I think part of the reason why our coverage rates are low could well be that the reminder letters that would usually go to the address where the women last lived at, they're no longer there, and so they're no longer getting their reminder letters. But it's with having workforce like yourselves to be able to encourage that message and work with the cervical screening program, health promotion team, it makes a difference, as well as all the workforce and the practices as well. So is there any final advice that you'd like to give to women of Waitaha?
I think post-earthquake, we're starting to settle down a little bit now. So most women are attending general practice. Māori do go to their GPs. So it's really important, if you don't feel that you could go to your doctor, then please do contact the 0800 number. It's 0800 729 729. It's really important that they do have a smear and follow up on whether they are overdue or not overdue. I think the importance about Leanne is also mentioned. It's important that we are here for our mokopuna. That's the one reason why you should, one of the many reasons why you should continue having your smears at a regular, every 3 years is when we do come in for smears, unless indicated that it's yearly or otherwise by your smear taker. But we're a friendly group, and
we won't bite.
No, we love seeing women. It keeps me real. I love talking to women.
Yeah, kau e whakamā. Haere mai wahine mā. Have that first smear, because honestly it isn't as bad as you think it is. It's not a process that any woman likes to go through, but it could save our life, and it could help us extend our life and be around for our whānau. So for 10 minutes of feeling maybe a bit shy, it's worth a lifetime. That's all I can say.
Can I just add one more thing? I had a clinic about 3 weeks ago, and I had a young gay woman come to my clinic, and she made it very clear to me that she'd never been with a male partner, and so she didn't really think that she should have a smear. However, her partner had been with a male partner, and there is nothing to say that she should not have a smear. She should still have a smear. If she has been with a partner who has been with a male partner, then she is still needs to come and have a smear.
So it's that message you're trying to share is that all women that have been sexually active,
or being
from
with someone
20,
who's been sexually active,
from 20 onwards, are encouraged to have a cervical smear. Kia ora koutou wahine mā. Sometimes it's very hard to talk about the cervical screening program or having a cervical smear test, but we do encourage you as a woman, if you're aged between 20 and 70, to have a cervical smear. There are many Māori women and workforce in the community that you can talk to about finding more information about the cervical screening program and about the free smear clinics. You are a treasure to your family and you're a treasure to your whānau. He wahine he taonga, every woman is treasured. Kia ora.